Hello, this is Diana Varela. This is Diana Varela, and thank you for attending and watching this video. I work for the Social Security Administration, and I will provide to you information about retirement and Medicare. The first thing that I would like to share with you is how to conduct your businesses with the Social Security Administration. I encourage you to visit us online at www.ssa.gov. Most of the businesses you have to conduct with the administration can be done online. Either you are receiving benefits or you are not ready to receive those benefits. That's the first thing that you can do to take care of the businesses you have to conduct with us. The second way to contact us is give us a call. Our toll free number is 1 800 772 1213. We have representatives available to help you from Monday through Friday from 8 a.m. to 7 p.m. And I am glad that you're watching this video because we all want to have a wonderful retirement, but we need to have a different sources of income. We really need to prepare for the future. Social Security should not be the only source of income upon retirement. Social Security should only be the foundation of income that has to be supplemented with pensions, savings, and investments if that is possible, and of course, other sources of income. If you take a look at your pay stubs for 1 month, now that you are working, I can tell you that Social Security will only be about 40% of your pre retirement income. And most experts will tell you today that we need to have from 70 to even 100% of the pre retirement income. It is very clear that if Social Security will only be about 40% of the income we have upon retirement, we need to take the time to be ready for retirement and we need to start as soon as possible. And Social Security has a lot of tools and information to help you in the process. And the most important tool that we have available to you is My Social Security online account. If you have an online account, you will have access to your Social Security record at all times. You will be able to see your earnings record, the benefits that you qualify for, and also the amount of the benefits that you will get in the future. If you remember, we used to mail to you the Social Security statement. We do not mail the statement to all workers anymore. We only mail the statement to workers that are 60 years and over. If you're not 60, you're not getting your Social Security statement, but you can get access to that statement if you have a My Social Security online account. And even for those of you who are 60 and over, please create your online account because even if you receive your yearly statement, you are getting closer to the time in which you will file for benefits. And if you file for those benefits online, it will be the easiest and most convenient way to do it. If you have a My Social Security online account, that certainly provides that additional step because you have already proven your identity. So please create your online account as soon as possible if you don't have one. And for purposes of this program, in terms of how you become eligible to retirement benefits, I can tell you that there are two minimum requirements. One of them is that you must be at least 62 years old and that you have 40 work credits. A credit is a measure of work, and people earn credits when you work and pay into the Social Security system by paying your Social Security taxes. You can earn a maximum of 4 credits per year, and in order for you to earn 1 credit, you must make a specific amount of money in the year. Now, in regards to 40 credits, as you can see, in 10 years of work, you will be able to get the 40 credits. Most workers do. Now, but how many of you have already earned more than the minimum amount? And in order for you to get to know what is the minimum amount that you have to earn to get the 4 credits, please visit us online. And how many of you already probably earned more than that amount? And how many of you have already probably worked more than 10 years? So, what happens to the rest of the contributions into the Social Security system? Well, I can tell you that for most of us, working for 10 years, we will fulfill the requirements to get Social Security benefits. But the number of years that we're going to use in the calculation of Social Security benefits is going to be different because that depends on 35 years of earnings. These are the first 3 steps that we're going to use in the calculation of your Social Security benefits. As you can see in the first step, we're going to take a look at all of your earnings. If you have worked for Montgomery County or maybe some years with Montgomery County, some other years with other employer, but you have worked for 40 years, for example, we're going to take a look at all those 40 years. We will adjust those earnings to current value because of wage levels over time. And then we are going to find an average of your highest 35 years of earnings. Once we arrive to a monthly earnings, we are going to apply a formula that you can find, of course, in our website. And then that is basically how we are going to calculate your Social Security benefits. There are 3 factors that impact the amount of benefits that you will get. Number 1 will be the number of years that you have worked. Number 2, the earnings you had over those years. And number 3 is going to be the age in which you decide to retire. And that is going to be different for all of us because there are many, many factors that you have to consider and you have to apply those factors to your personal life. But what I can tell you is that there are options in regards to when you can take your benefits. As I said before, you can take your benefit as early as the age of 62. That's one option. Or you can wait until you are your full retirement age. And full retirement age is going to be different for all of us because it depends on the year that you were born. Take a look at the chart. In the first column, you will see years of birth. Second column will tell you what is considered your full retirement age depending on the year that you were born. Full retirement age means you wait to file for benefits until that age. We are going to pay you 100% of the benefits. But what if you decide to take the option of claiming your retirement benefits early as the age of 62? Then the benefits will be reduced, but it will be reduced permanently. Take a look at an example in regards to how this works. Let's assume that we have a worker whose full retirement age is 66 years old, and the worker can get a payment of full retirement age of $1,000. So take a look at the bar that represents age 66 payment, $1,000. The columns towards your left are the amount of payments if the worker decides to start collecting benefits as early as 62 or before full retirement age. As you can see, there is a reduction, and the reduction will be permanent. The reduction is about 6% per year that the worker files for benefits before full retirement age. So certainly for a worker whose full retirement age is 66 and the payment at full retirement age is estimated at $1,000. If that worker choose to retire early at 62, the worker will get a 25% reduction. Once again, permanent reduction, the worker will get a payment of $750. If the worker files at the age of 63, then there is less reduction that we will apply and the payment will be higher. So you can start as early as 62. You can wait until full retirement age. Those are a couple of options you have. And there is one more option. The option is you can wait until you are past full retirement age until 70. And what happens if you actually wait to file for benefits past your full retirement age? You start getting 8% increases. So as you can see, for this worker whose full retirement age is 66 and the worker waits until 70 years old, we are going to pay 32% increase, 8% per year. So at the age of 70, the worker will get $1,320. That increase is also prorated. It's 8% per year. And that can be earned until the age of 70. So when you ask me a question in regards to what is the best age to start collecting my benefits, I don't have an answer for you because it's going to be personal. There are many factors you have to take into account. But I can tell you that you can start as early as the age of 62, and we will say do not delay your benefits past 70 years old because after 70 years old, you do not get any more 8% increases. I invite you to visit us online. We have a great publication that is called When to Start Receiving Retirement Benefits. It tells you many factors you have to take into consideration before you arrive to the answer. This is the best time for me and for my family. It's going to be different for all of us. I wish that I can give you like a magic age, but it is not possible to do that. It's going to be on a one-on-one basis because all of us will have different situations that might prevent us from filing for benefits or might push us to actually file for a benefit early. So please, take your time to make your decision. I can tell you that for some workers at the age of 62, if they are not working, they are looking for employment, they cannot find employment, filing for early benefits might be a good decision. For others, might be because they are undergoing a disability. And, at the same time, we might have workers that are actually full retirement age already with, no health issues. They are working, they enjoy their employment, they don't have any family issues. So why not waiting? So it's going to be different for all of us. Please, um, make sure that you get the information ahead of time so you can make the right decisions. Another one thing that you have to consider is that some beneficiaries, some people receiving Social Security benefits might have to pay taxes. Um, Beneficiaries or people that have incomes of more than $25,000 and are receiving Social Security benefits, or couples with incomes of more than $32,000 will have to pay taxes on some of the benefits. I am not an expert on taxes. As you can imagine, we leave those inquiries to the IRS. No Social Security representative can help you in regards to your taxes questions. But please contact the IRS, irs.gov. You can also give them a call at their toll-free number. And they have a lot of publications and also our tax withholding calculator. But if you just want to get a little bit of more information so you can be prepared, this is the formula that will be used. As you can see, all of your adjusted income will be considered, including half percent of your Social Security benefits, any non taxable interest that you have, all of your incomes. And if your combined income is higher than the threshold, once again, 25,000 for single taxpayers, 32,000 for couples, then be prepared, you're going to have to pay taxes. Also, know that we can deduct federal taxes from your benefits. Then that way you pay those taxes along the year, but you have to give us your consent. You have to complete a form that is available in Social Security's website and also the IRS website. That is a W4V. W4V. That's the form you will have to request um, withholdings. And um, working while receiving benefits is another factor that you will have to consider. A lot of people ask us all the time, do I have to stop working completely to receive benefits? And the answer is no. We will allow you to work and still receive benefits. If you are your full retirement age, the month you turn your full retirement age, you don't have any limits in the amount of earnings that you can have. You can continue working for the county full time. We will still pay you benefits every month. However, if you are under your full retirement age, then there is a limited amount of earnings that you can have in the year. And I want to show you very briefly where you can find information about retirement. Okay, if you actually visit us online, there are a couple of ways where you can find information on retirement. As you can see on the website, it says retirement. You can click on retirement, it will open the retirement page. But you can also go to the menu, and once you click on menu, there will be a drop down box that comes towards your left. One of the options you have is the frequently asked questions. And under the frequently asked questions page, you can actually find information about retirement, most common questions about retirement. Okay, so please visit us online, get the information on the benefits that you need. One thing that is very important in regards to applying for retirement benefits is you must consider if some family members can receive benefits under your record. Most people tend to believe we only pay benefits when the worker is deceased, and that is not so. The worker might be alive and receiving retirement or disability benefits, and we can pay benefits to spouses and children, and even divorced spouses. So I have a comparison chart that will allow you to see what is the differences between the two benefits, and also, some similarities. But once again, the bottom line is yes, we pay benefits to family members of workers that are either retired, disabled, or deceased. The information towards your left is when the worker is alive. The worker must be receiving retirement or disability benefits, and we can pay benefits to a spouse at any age if the spouse has a child in care. Child in care for Social Security is defined as a spouse that is taking care of a child under the age of 16 or a child that might be an adult but is a disabled adult. And we also pay benefits to spouses beginning at the age of 62. But once again, age 62 benefits means that the benefit will be reduced. Any benefits that you file for Social Security and you file for benefits under your full retirement age, the benefit will be reduced. And of course, spouses can wait until full retirement age to get the full amount of the benefit. The amount of benefits that we will pay to a spouse is an amount equal to 50% of the worker's full retirement age amount. We'll go over a few examples in just a few minutes. Now, take a look at the column towards your right. That is for survivors when the worker is deceased. We can still pay benefits to a surviving spouse with child in care. We also pay benefits when the surviving spouse is at least 60 years old or even 50 if also disabled. Those are the requirements for survivors. Also, take a look at the amount of the benefits that we can pay. The rate of benefits for a surviving spouse that is just 60 years old is 71.50%. And of course, we could even pay up to 100% of the deceased worker's benefits to the surviving spouse. So take a look at that, please, and know that, of course, we have all of this information online. We even have publications on survivors and also information that you can access online about spouses' benefits, including a benefit planner. Now, besides the spouse, we can pay benefits to divorced spouses as well. The other requirements for a divorced spouse is that the divorced spouse was married to the worker for 10 years, is single at the time of application, must be at least 62 years old, and in regards to the worker, for a divorced spouse to file for benefits from a worker, the worker must be at least 62 years old. So as soon as the worker is 62 and the divorced spouse fulfills the criteria of eligibility, that divorced spouse can file independently from the worker. Remember that for the current spouse, I said that the worker must have filed already, must be receiving benefits. That is not so for the divorced spouse. The divorced spouse can file independently as soon as the worker is 62. It doesn't matter that the worker is not filing for benefits, is remarried, is still working. The divorced spouse can file independently. Now, let me give you basic information in regards to spouses' benefits. And remember how we talked about before for a worker who applies for benefits before full retirement age, the benefit will be reduced. Well, that is the same for the spouse. If a spouse files for benefits before turning full retirement age, the benefits will be reduced. So take a look at the chart, and depending what is considered full retirement age for the spouse, you see the reduction that will be taken at the age of 62. Okay? Any benefits, once again, any benefits you file with us before full retirement age, the benefit will be reduced permanently. Let's do a summary of spousal benefits. And we will do some examples and scenarios so you can understand a little bit better in regards to these benefits. Once again, for the spouse's benefits, the worker must have filed, the worker must be receiving either retirement or disability benefits. We're going to pay an amount equal to 50% of the worker's unreduced benefit, that is full retirement age amount. And of course, if that spouse files for benefits early, we are going to reduce that benefit. Let me give you a scenario on this in regards to a worker who is actually in a family where we have one of the spouses, it's a stay home spouse. Let's say that we have a worker who is going to get $2,000 at full retirement age. The worker has a stay home spouse. So it says here that a spousal benefit is an amount equal to 50% of the worker's unreduced benefit. Well, in this scenario, if the worker is getting $2,000, the stay-home spouse is going to get $1,000. Total family benefits, $2,000 for the worker and $1,000 for the stay-home spouse. Of course, if the stay-home spouse applies for benefits before full retirement age, the benefit will be reduced. Now, the other scenario, if a spouse's own benefit is less than 50% of the workers, they will be combined to equal to 50% of the workers. In this scenario, we have a couple, both of them have work, both of them have the 40 work credits required for retirement. Just happened to be that one of the spouses had less earnings through their life because they were spending a lot of time taking care of a family. Let's say that in this scenario, the worker with the higher earnings record will get, again, $2,000. Let's say that the spouse with a lower earnings record will get only 500. Of course, remember that benefits are based on your earnings. So if we have a worker who had less earnings, we will expect that this worker will get less benefits, right? So in this scenario, if we have that spouse that can get only $500 on his or her own record, but is married to a worker that will get $2,000 at full retirement age, what we will do is we are going to compare the benefits that this stay-home spouse will get on his or her own record and the amount of benefits that represents a spousal benefit on the other spouse's record. So we can clearly see that for the stay-home spouse, we can get, $500, because for this spouse, the earnings are less, stay home for a while, had less earnings, and then we can compare to the 1,000 that we can pay from the worker, from the spouse with the higher earnings record. It would be like telling this spouse with the lower earnings record, we can pay you only 500 on your record because you work less years, you had less earnings. But under your spouse's record, we can pay you 1,000. Which one would you rather get? We will always find the higher amount to pay the higher amount. And in this case, what we will do is we will still pay that spouse with less earnings the 500 that he or she earned, another 500 from the other worker's record, and that would be the higher amount, a combination of the benefits to equal the higher amount, which is 1,000 in this case. What I can tell you is that once you apply for benefits and also once your spouse applies for benefits, we are going to take a look at the both records to find out which one is the higher for you. There is probably one more scenario, and in this scenario, we have a couple. They made the same about the same amount of earnings. So, what will happen in regards to the benefits that we can pay to them? Well, let me give you an example. Let's say that we have a worker who will get $2,000 on his or her own record and is married to another worker that will get 1,800 on his or her own record. That will certainly be the higher amount for each of these workers. So it will be more beneficial for them to apply for benefits, each one on their own record, because on their own record they will get the higher amount. We will do this once you apply or once your spouse applies. One thing that you also need to take into consideration is benefits that we can pay to children, not just to spouses, but also to children. Social Security pays benefits to children. Same requirements for children when the worker is alive or deceased. We can pay benefits to all children under the age of 18 or even between the ages of 18 and 19, but if they are still in high school in full time attendance. And we even pay benefits to children that might be beyond 19 years old if they are disabled and if they became disabled before the age of 22. We can pay benefits to them. Same requirements. The only difference is that when the worker is alive, we're going to pay an amount equal to 50% of the worker's full retirement age amount. In other words, if mom or dad are getting $2,000, let's say $2,000 retirement benefits at full retirement age, a disabled adult child is going to get $1,000. When the worker is deceased, the rate actually goes up to 75%. So it's important that you take a look at all these factors so that way you can make your decisions, because certainly all of these factors need to be considered when you're making a decision. And once you make your decision, the way to file for benefits, it's first way to file that we recommend is going online. The application is user friendly, is very simple. You just have to answer questions, and then these are questions that you know because these are questions from your record. Now, of course, if you are unable to complete your application online, when you visit ssa.gov, then the other way to do it is please give us a call at the toll-free number 1-800-772-1213. We are going to schedule a telephone appointment for you, and we recommend that you contact us either online or by phone at least 3 months before you want your benefits to start. Remember, 3 months before you want your benefits to start, contact us so you can complete your application. If you cannot complete your application online, then give us a call. We will be more than happy to schedule an appointment for you. Okay, now let's talk about Medicare. Medicare is very important, okay? And also one thing that I would like to let you know is that once you are applying for benefits, you need to give us what we call advanced designation of representative. We have a program called Representative Payee, and The reason why we have this program is because we recognize that we might have beneficiaries that are unable to handle their own affairs. For example, children or even adults that, due to disabilities, perhaps they are unable to handle their own affairs. Well, Social Security appoints representative payees that will help the beneficiary who is not able to manage their own benefits with their care. Basically, a representative payee is the person that manages the benefits, and we are requiring for new claims beginning March 2020 that you provide us with advanced designation. You're going to have to give us the name or contact information for at least three persons that we could contact just in case something happens later on and you are unable to manage your own benefits. Okay, now let's talk about Medicare. Medicare is very important because this is the national health insurance. And Medicare is given to workers that are at least 65 years old or workers that at any age are disabled and receiving disability benefits. There is a waiting period of 24 months. The only workers that do not have a 24 months waiting period are those workers who are undergoing ALS, Lou Gehrig disease. They are receiving disability benefits because of Lou Gehrig disease. They do not have a 24 months waiting period. The Medicare eligibility starts as soon as the disability payments start. We also provide Medicare to younger workers who are undergoing dialysis for 3 months because of kidney failure. They can file for Medicare at any age. And you can consider Medicare as being as part of the family benefits because certainly if we have a worker that has a stay-home spouse that never work outside the household, that spouse can get Medicare eligibility as well. And Medicare is very comprehensive, provides coverage for hospitalization, doctor's visits, um, medical equipment and supplies, including diabetic supplies, for example. And it is also important to let you know that, of course, Medicare is like any other health insurance, provides coverage, but it doesn't pay for all expenses. There are some deductibles and some copays, and some of the parts of Medicare might have a monthly premium. So let's talk about the two options that we have in regards to Medicare. We have the Medicare Original Plan, and we also have the Medicare Advantage Plan. What's the difference between the two? The original plan, it is divided into different parts. Part A is part the hospitalization, and you do not have to pay a premium for the part A for as long as you have your 40 credits. That's what I said. Some have premiums, deductibles, and copays. The part A has deductibles and copays, but no premiums for as long as you have your 40 work credits. Now, part B is medical insurance, doctor's appointments, any outpatient services is covered under the Part B of Medicare, has premiums, deductibles, and copays. And we also have the prescription plan, which are actually private companies contracted by Medicare. And they all have different premiums, deductibles, and copays. It depends on the plan that you select. Then the premiums, deductibles, and copays will be different. And the Medicare premiums, deductibles, and copays are different from, year after year. And I'm going to show you in a few minutes where you can find information about the current premiums deductibles and copays. But also know that under the Medicare original plan, since it doesn't cover for all expenses, those deductibles and copays can be, um, an extra expense to you. And some beneficiaries choose to have a supplemental plan. It's called a Medigap policy. In your case, if you are a Montgomery County employee and you will be eligible to receive health insurance benefits after you retire from the county, then that county's plan upon your retirement will become your Medigap policy. The Medigap policy, whatever Medicare doesn't pay, then your Medigap policy should cover. There will be a coordination of benefits. In regards to the Medicare original plan, you can take all of the parts at the same time, or you can take some parts first, some parts later. And so we're going to talk about the different enrollment periods, and we will revisit that information in just a few. But in regards to the Medicare Advantage plan, that's the information towards your right. These are actually private companies contracted by Medicare, and they are usually low out-of-pocket costs to you. Most of them are HMOs. And there are different plans in the area. Okay, so that's basically what the Medicare Advantage plan is. Some of these plans are actually plans that will provide you with extra benefits such as vision, hearing, dental, and some other services that the Medicare original plan does not cover. I invite you to um, please visit us online, and I will show you some other websites that you can visit to understand Medicare a little bit better. But also, I would like to provide you with information about the different enrollment periods. And we have 3 enrollment periods: initial enrollment period, a special enrollment period, and the general enrollment period. The different periods, okay, in regards to eligibility to enroll in any of the enrollment periods is really going to be once again on a personal basis, and I know that sometimes you don't want to hear it's going to be different, it's going to be on a personal basis, but that's the reality, that all of us will have different situations, and each one of us will have different needs for different benefits and services. In regards to the Medicare enrollment periods, I can tell you that, from all of us in the call, probably some of us will have to enroll in the Medicare initial enrollment period, maybe the special enrollment period. So please use this information to find out when is the best enrollment period just for you. Now, first of all, we have an initial enrollment period. And the initial enrollment period is basically for those workers turning 65 years old. You will have 7 months to enroll in Medicare. You will have 3 months before you turn 65, the month you turn 65, and 3 months after. That is what is considered your initial enrollment period for Medicare. You can enroll in any of the 7 months, but if you actually need your coverage to begin on the first day of the month you turn 65, example, you are already retired from the county and you have the county's plan, but you are retired, then you might want to contact us, you know, 3 months before you turn 65. Because at the age of 65, you need to have that Medicare coverage in place. Now, it might be another situation in which you are close to turning 65 years old, but you're still working you're still working for Montgomery County government and you have health insurance with the county. Well, then that is going to be different because if you are still working and you have health insurance based on your current and active employment or health insurance based on your spouse's current and active employment, and the employer has more than 20 employees, then that will be your primary care health insurance. So if you don't need to file for Medicare at the age of 65 because you have health insurance in place that is based on your current or your spouse's current and active employment, then you can defer Medicare. You will be under what we call a special enrollment period. That is for people who are 65 or older and cover under a health insurance based on employment or a spouse's employment. You can defer Medicare under the special enrollment period for as long as you or your spouse works. And we even give you 8 months after you or your spouse retires to file for Medicare under that special enrollment period. Okay, um, so please um, get more information. You can get more information about the Medicare enrollment periods in our website, uh, www.ssa.gov. Now, for people who miss the initial enrollment period or the special enrollment period, there is one more period, which is the general enrollment period, as you can see. But that period is very specific in the year. It's January through March of every year, and the coverage begins in July. There is new legislation, okay, and now the coverage actually will start the month after you file. So stay tuned on that, please. And just know that, and I can tell you from my personal experience that if you are working for Montgomery County and you are already retired at the age of 65, sometime before you turn 65, Human Resources will send you a letter stating that you need to file for Medicare. Now, if you are working, of course, once again, you can defer Medicare, all of the parts or just some parts, and then get, more information from your representatives in human resources. Of course, to get more information on Medicare, I invite you to visit us online once again. And as you can see, there are two ways to get more information on Medicare. You can directly from the website. You can click on the picture where it says Medicare, or you can go through the main menu at the top. And once you click on the menu, you can get to the frequently asked questions. And then from the frequently asked questions, you will be able to actually get to Medicare. Um, for people who have higher incomes, I said that Medicare premiums will be higher, and you can find the information on that web page. Once you are ready to apply for Medicare, once again, you can complete your application online. You can complete your application online even if you only want to file for Medicare. You are not ready yet to file for cash benefits. You can just file for Medicare online. The other option, of course, is give us a call, 1-800-772-1213, and schedule a telephone appointment with one of our representatives. And as I said before, in regards to filing for benefits, we would like for you to contact us at least 3 months. Between 3 or 4 months before you want your benefits to start, please contact us. And if you, at the age of 65, you were still working for Montgomery County and you had health insurance with the county, or maybe your spouse had health insurance for you at the age of 65 and they were still working, current and active employment, remember that what puts you in a special enrollment period at the age of 65 is that you or your spouse are working and you have health insurance based on that current and active employment. So if that was the case at the age of 65, you defer Medicare, you only file for Part A, you defer Part B. These will be the two forms that you need to put Part B, to add Part B to Part A of Medicare. These two forms. 40B is your request to enroll in Medicare, and the L564, your employer will have to complete that because they need to certify that at the age of 65, hey, you didn't take Medicare because you were still working and you had health insurance from your current and active employment. This is the other website that I invite you to visit, medicare.gov, because if you're just trying to get information about the Medicare coverage under the Part A, Part B, what is the cost of Medicare, resources in regards to agencies that will help you to navigate through the Medicare decisions, okay, please visit medicare.gov. It's very useful. And once you start receiving Medicare, you can create an online account. So that will be the way to manage your Medicare benefits. If by any chance you know somebody already who is receiving either retirement and Medicare benefits, and you know the person has lower income and resources, please let them know there is extra help. Extra help is assistance provided by the Social Security Administration to beneficiaries who have lower income and resources. With extra help, Social Security pays for the premiums, deductibles, and co-pays of the prescription plan. And chances are that the income and resources of the person might qualify them to additional benefits with the state through the Medicaid services, and they can get the Medicare Part B premiums paid as well by the state. So there are many, many resources for people with lower income and resources. And I can tell you that sometimes they do not even know. If you think about a beneficiary that is 80 plus years old, or a beneficiary that is younger but has a disability, sometimes they do not know about resources available in the community. So please, if you know somebody, make it a commitment to share the information with them, because chances are they don't know of these additional benefits. They can either contact Social Security at the toll-free number or visit us online, or they can contact the social services agency in the county where they live, or maybe you can even assist them to file for extra help and some other benefits online. Okay, so please, please. And once again, I invite you to visit us online, ssa.gov, because all the information in this recording, it's available online. When you visit us online, you have access to online publications, benefit planners, and calculators. You can create a My Social Security online account. If you are a fan of Facebook, you can become a friend of us in Facebook. You can even send us questions through Facebook. Of course, no personal information, please, on Facebook or Twitter. We have Instagram, we have blogs and newsletters that you can register, and that way you get information on a regular basis, you will be able to stay abreast of what is happening with your Social Security benefits. So once again, please visit us online at ssa.gov. You can conduct most of your businesses with my agency online. If you are unable to conduct your business online, then give us a call. Our toll free number is 1 800 772 1213. I hope that you enjoy this recording and most of all, that you can use the information to make those important decisions about retirement. Thank you for watching.